So today, as our first speaker, we have Amal Killawi. She's a clinical social worker, researcher, and a community educator. And she's a fellow at the Family and Youth Institute. She has a presentation that she's going to start with.
I appreciate the short intro. Jazakallah. And good morning. I wish I could be there in person with you all, inshallah, another year. But I have attended the Muslim mental health conferences like since they started way back. I don't even remember when at MSU. So subhanAllah, they've evolved and now are online. So which is convenient for some of us, but it's always nicer to have the in-person experience. So welcome to our first session of the morning. I will be presenting. So just real quick for I think it was that Iqtidar that introduced me?
Yes.
People are entering the waiting room. Am I admitting them?
I'll admit them.
Okay. So I just didn't want to ignore people coming in. Okay. So my name is Amal Killawi. I'm a PhD candidate at Rutgers University. I'm a clinical social worker by training. So I've had experience counseling, college students, domestic violence survivors. And I've also had my feet in the research world. So I'll talk more about my research experience later, but as a social worker, I've kind of found myself in both practice and research for a very long time, and ultimately decided to pursue the research route. And now I'm working on my PhD in social work at Rutgers. For those of you who are familiar with social work, a PhD in social work is strictly a research degree. So it's not like added clinical experience. And I also happen to be working with the Family and Youth Institute for many years as well. I'm an community educator, as well as a board member and a researcher. And Madiha will be co-presenting as well. And she's going to share with you a little bit more about how the Family and Youth Institute has attempted to apply some of the principles I'm going to discuss with you today, community engaged research, and how we've attempted to really infuse that in our work. So let's go ahead and get started. So I just wanted to note that the presentation was compiled from the following resources, just for, just so you all know that it came from so many different people's work. And I had a question for you all, something to think about early this morning. And the question is, what do researchers and mosquitoes have in common? It's not really, it's kind of a trick question, but we'll see if anybody knows. I can't see your faces, so I'm hoping it's
one of the guess. Is it because they live off other people's products?
Well, close enough. Yes, according to a native Alaskan saying, researchers are like mosquitoes. They suck your blood and leave. And I think, this saying is, it's jarring, but it reflects the fact that there's been an extensive body of research that's been conducted amongst populations around the world, but have had really little impact on those individuals' well-being, right? Those communities' well-being. And so it's important for us to reflect as, I'm going to speak to researchers, but really also as practitioners, because we use research, right? So why we tend to be viewed oftentimes with skepticism by many communities. And the way that we acquire knowledge in communities may be just as critical for how we eliminate disparities as the actual knowledge that we gain. So I'll say that again, the way we actually acquire the knowledge to address disparities is just as critical as eliminating disparities and the actual knowledge that's gained, right? So we don't want to be mosquitoes. Let's not be mosquitoes. And so community engaged research has often been proposed as a solution to the skepticism that is experienced by communities and the mistrust. And that's the focus of the session today. So I'm going to walk you through just some big concepts around community engaged research and give you a case example of how we've tried to implement that in our research projects. And then Madiha will speak more specifically about the FYI. So community engaged research, especially CBPR, and I'll define some of the terms as we move forward, is really rooted in the principles of diversity, equity, and inclusion. And sometimes, unfortunately, even though we may be well-intentioned as researchers, we might be assuming that we know what's best for people. So as you see in this cartoon, right? Many of us are sitting in our ivory towers as academics, right? Us and others included, and I'm speaking for myself too, because I think we can all, unfortunately, sometimes be guilty of this. And it's important for us to recognize that we don't have a monopoly on knowledge. And oftentimes, even though we're well-intentioned, we think that we know what's helpful for a community, and we know what's an important intervention, what's an important research design, what's an important research topics, whereas members of the community may have other ways of knowing that are not really acknowledged or recognized. And so if we're going to engage communities, a really important element is cultural humility. We have to be culturally humble and be genuinely curious and asking questions as opposed to assuming that we know what's best for communities. And I kind of already defined that, but it requires, cultural humility really requires that we're engaging in an ongoing lifelong process of reflection, and not assuming that our identity or that our knowledge is better than someone else's knowledge, right? And we're also recognizing the dynamics of power and privilege as researchers and people oftentimes in academia and as clinicians too, right? We recognize that we tend to have the power in the relationship, especially when we're working with vulnerable populations. And ultimately, cultural humility is needed for us to be able to engage communities in research. And it forces us to kind of get rid of the notion that we're the experts and we know what's best for communities. This is not discounting our knowledge, but it's also upholding communities' knowledge. So just really quickly, some of the learning objectives for today is just helping you recognize the difference between traditional research and community engaged research, summarizing some of the definitions, discussing a little bit about the challenges and the benefits of using a CBPR approach, and then giving you a case example and encouraging you to think about how you can apply some of these principles in your own work. And I think we're going to have a discussion afterwards. So I'll try to get through this quickly, and then inshallah, we'll open it up for Q&A after Madiha presents as well. So basic concepts like community. When we think about communities, we really have to take a step back and think about what we mean by the word community. So when you think of community, what does that mean to you, right? Like, how do we define a community? And oftentimes we're thinking about it geographically, but it's much more than that. It includes just really simply people who are linked by certain characteristics, right? So as researchers, I might be working with a senior citizen community, even if they don't necessarily live in the same area, right? But they're still considered part of a community. And so the idea is that we need to expand our thought process around what we mean when we use the word community, particularly in research. Similarly, when we talk about who the Muslim community is, right? This is the Muslim Mental Health Conference. So many of us are doing work within Muslim communities. But who are we talking about when we talk about working with the Muslim community, right? Who's our audience? And we often like to talk about the diversity of Muslims when we're speaking about Muslim communities, but sometimes we are guilty of perpetuating a certain stereotype of what the Muslim community should look like, right? So I think for me personally, I try to move away from saying I'm working on research in the Muslim community as opposed to in Muslim communities, right? Trying to move away from language that's, generalizing one incredibly diverse world population, right? So just some food for thought this morning in case you haven't had your coffee. So again, let's talk about the different approaches to research. Most of you are familiar with the traditional research process, which is this top-down process where researchers are developing the research questions, writing proposals, securing funds, conducting the research, the analysis, writing papers, all of that, right? Most of us are familiar with this process because that's what we were trained in, right? And it's really a top-down model in which researchers are the experts and they enter communities, they enroll or recruit subjects in their studies, and then leave when the research has been completed. So remember the mosquitoes, right? And we know that this has been the case for years in the United States, and especially since this is our context, right? This is why so many communities have a legacy of mistrust of researchers and the government. So for example, some of you can probably remember the Tuskegee syphilis experiment, right? In 1932, where Black men with syphilis thought they were part of a special government health program, and they didn't provide consent and they weren't offered treatments when they were available. And so for a long time until today, so many communities are still mistrustful of researchers because they were taken advantage of. Right? And there are so many more examples. We don't have time to go into them, but I want us to take a step back and think about how we as researchers are sometimes perceived by communities and how we may not even recognize that. And this includes, both communities that are not Muslim and communities that are. Now, being the subject of research, right, the terminology, think about how the terminology has evolved. I know in social work, when I was I have a bachelor's in psychology. So at the time we used words like subjects, right? When I moved into social work, the language has evolved to describe participants, respondents, right? And when you think about being a subject of research, being a participant or a respondent, there's a completely different connotation, right? When we use terms like participants, we're thinking about our individuals who are collaborating with us as collaborators, right? As equal partners. And so I want us to think about shifting away from, sometimes, unfortunately, some of the fields are still using these kind of outdated terms, but it's incredibly important to recognize that there are certain connotations that are associated with these terms. So community engaged research builds upon traditional research. But the difference is that in the relationship between the community and the researchers and how the community participates throughout the research process. So in a community engaged research model, researchers and community agencies or groups or individuals are forming a partnership. And this is going to look different, based on the project, based on the community. And essentially it's, putting the community at an equal level on the same platform as researchers. Now, researchers and communities may work together during one step or two steps of the research process or the whole research project. And we'll talk about how that plays out for some communities. So the term community engaged is really broad. I mean, I think, when I was preparing for the presentation, it's really overwhelming the number of terms. I feel like sometimes in academia, we have a way of making really simple concepts incredibly complicated. And so I just want us to take a step back and think about community engagement as a very broad term. And it includes a spectrum of approaches of involving the community in the research process. So on the one end of the spectrum is, an example in which the community might have little cooperation or collaboration with the researchers. All the way to the end of the spectrum is what we call community-based participatory research, and that is characterized by an equitable partnership. And I'll talk about CBPR more thoroughly in a little bit. But the idea is that think about where you lay on the spectrum, right? When you're doing your research. Are you kind of in the middle? Are you really trying to implement principles of CBPR? Or are you kind of still, at the beginning of the spectrum where the community might not be as involved? And the idea is that we're moving away from doing research on communities to doing research in communities, to doing research with communities. So seeing community members and communities as equal partners. So we keep talking about CBPR. I'm just going to give you a quick overview of what it involves. It's just, again, it's the end of the spectrum. And the idea is that it is an equitable process of research, or approach to research, I'll say approach, I think is the accurate term, that involves all partners in the research process. It recognizes their unique strengths, and it begins with a topic that's important to the community. And the thing that distinguishes CBPR from other research approaches is that it combines knowledge with action. So the idea is you're not just doing research for the sake of research, you're doing research with the intention to create social change and improve communities' situations, right? Or address community needs. And I think that's really important for the work that so many of us are doing as providers as well. And this is also connected to the work that we do at the FYI. I want to stop here and note that all of the terminology can be a little confusing. So you'll see all of these terms outlined in the literature: community-based research, community-engaged research, participatory research, action research. The idea is that they are all one way, they all fall under the umbrella of action research, right? So like I said, not research just for the sake of research, but also that research that contributes to practical concerns that people have. And it also furthers the goals of science. And that's what we do at the FYI. And Madiha will walk us through some examples. So some of the distinguishing features, I think I mentioned this earlier, is that CBPR completely flips the framework of traditional research on its head. And it changes the power dynamic. So think about the top-down model of traditional research. The idea here is that the community members, and not just, we're not talking about like your random community members, right? People who are like invested in the process, and there's a whole process of pulling in community members. But the idea is that the community possesses knowledge and they are experts on their own culture and health and needs, right? And so you're centering the community and putting them on an equal platform with the researchers. So there's mutual responsibility. Everyone is responsible for moving the project along. The communities might be identifying the concern, the issue to be researched, right? And they're working collaboratively with academic partners or research partners, but they're seen as experts. And I want us to pause for a moment and think, why would CBPR be an important approach to research? And I have outlined some of the reasons here, right? I mean, some of them really simply said, I think, because CBPR ultimately builds community capacity, right? We want to empower communities. We don't want communities to just be dependent on researchers and academics and experts. Ultimately, we want to empower people, right, to make decisions for themselves and for their communities. And so when you're placing communities as equitable partners in the research process, you're valuing them, right? And you're empowering them, and you're helping them build the capacity within their community. And there are a few other reasons, right? It's building upon their skills and their strengths. It's giving communities a voice, because oftentimes we as researchers and academics have a lot of power, right? And we may have access to funding. Also, for those of you who appreciate the challenge, CBPR is a challenging research approach. So it can be invigorating, and it can kind of shake things up from the regular research process. And it solves real world problems for people, and it's investing in relationships, and it doesn't pretend to be objective. So we're acknowledging that, we are centering communities. So just a few reasons why you might consider CBPR as an approach, or I'm using CBPR, but community engaged research approaches. And I want to contextualize this really quickly just to show you how much more popular CBPR has been in the academic world. Now, I learned about CBPR back in 2009 and became involved in a project by the Robert Wood Johnson Foundation. And since then, it's absolutely exploded. The slide is kind of outdated at this point, right? If you think about the research literature, there has been many more publications around CBPR and engaging communities in research. And for those of you who are attempting to acquire funding, a lot more funding for research approaches that center communities. And that's something that I think is really important as well. Now, there are different models of CBPR. There's really simply one model in which there's a collaboration between a university center and a community organization, right? So for example, at Rutgers Institute for Families, they might be collaborating with one mosque or a social service center. Now, model two is a kind of a larger collaboration between a number of academic researchers and a small group of community organizations. And this was the model that we used in the case example that I'm going to walk you through. It was a collaboration between the University of Michigan and 4 Muslim-focused community organizations in Michigan. And then model 3 is just a much larger broad-based coalition of so many grassroots organizations. And you can imagine this is a lot harder to pull off. Some principles of CBPR, I'm not going to walk through all of them, but these you're going to see in the literature oftentimes. And it's important to note them and to recognize them, because the reality, as you'll see from our case example, is that for some projects, it may not be realistic to try to uphold all of the principles, but at least it's a guiding framework for when we are attempting to engage communities in this process. Again, how is CBPR different? We talked about this, right? CBPR is much more active and participative, and usually focused on action and applying the research or applying the outcomes to communities, and it's collaborative and change oriented compared to what you are probably most familiar with as in the traditional research model. Again, obviously I love my graphics, but I thought this was really helpful because I think it's helps us think about where we are as researchers. So this table is really reflecting the difference between traditional research approaches and then community engaged research, which includes research with the community and then CBPR. And I think many of us fall into the middle. You know, we may not necessarily uphold all of the traditional research approaches, but we are really trying to center the community. But realistically, we're kind of in the middle, right? Where we're in the community, we're working with the community, but maybe it's not really a community-based participatory research approach, right? And we'll talk about why oftentimes it might be a challenge to get to the end of the spectrum. Okay, we'll skip this one too, but I want you to think about what are some of the inherent challenges with using a CBPR approach. So I've kind of noted that it might be challenging to apply all of the principles. And I think one of the things that we can think about is that CBPR is challenging work. It's really difficult to do. I'm not trying to discourage you all, but think about building a partnership and what that entails, right? You're investing in a relationship. You know, you're taking a lot of time, trust, attention, reflection. You have to make connections. You have to spend time making those connections and investing in those relationships. And sometimes it takes, well, not sometimes, a lot of times it takes many years for people to establish relationships. And think about some of the academic institutions that may be engaged in CBPR work and how long it took them to establish trust within communities, particularly Black and Brown communities, right? The other thing is that CBPR is often not valued in the academic world, right? Especially in a world where you have to publish or perish. You know, people may not be willing to wait on you as a researcher to establish relationships and build a foundation and move the project along, right? They want to see outcomes immediately. And this flips the framework, right? It completely flips it on its head. Sometimes the community doesn't want to be involved in all the aspects. And sometimes there are just logistical concerns, right? Or time constraints or lack of infrastructure. And, you know, it just might not be necessarily appropriate for all research endeavors. So just something to think about as well when we think about CBPR. Yes, there are tremendous benefits and strengths, but there are going to be challenges and some difficulties. So I'm going to give you a case example from my experience and I'll wrap up the presentation, inshallah. But, you know, back in 2009, I was graduating from my social work program and I was looking for a job and couldn't find a full-time clinical job. And so ended up doing part-time counseling work and then part-time research work. And I was hired onto this project. And I ended up, you know, being like immensely involved in this project from start to finish. And it was my first exposure to CBPR. And it was just a fascinating experience, given that CBPR approaches really haven't been utilized with many Muslim communities. And so to our knowledge, we ended up publishing a paper about our experience. This is really kind of one of the first well-documented CBPR experience amongst mosque communities. And this was the first study to utilize a CBPR approach for health research within American Muslim mosque communities. So it was situated in Michigan, in Metro Detroit. Some of you are probably, many of you are probably familiar with the area. And we ended up, really what we were interested in was trying to understand what are Muslim health beliefs and practices, how are they impacting people's healthcare seeking experiences or practices, and what challenges are Muslims facing in the healthcare system. And ultimately, we ended up with a partnership with 4 community organizations, and we interviewed community leaders, stakeholders, and also conducted 13 focus groups at 7 different mosques. So the partnership involved 4 key community partners, some of which you may recognize. ISPU, I think many of you recognize. Access, a community health agency, and then 2 Islamic umbrella organizations. So CIOM, which was CIOM, and the other mosque umbrella organization actually ended up joining forces at some point. But the idea was that we were engaging communities at different levels. So we were engaging these community partners. We were engaging mosque leadership, because remember, our focus groups were held at different mosques and we were recruiting at different mosques. And we also were engaging participants on an individual level. Now, to establish the partnership, the principal investigator, some of you may know him, Dr. Asim Padilla. He was a physician and had relocated to Michigan a few months before the project and spent really most of the year visiting mosques, participating in events, meeting with religious leaders, meeting with community leaders, and just trying to get to know people. And through those conversations, he identified these 4 organizations. And I'm giving you his example from his perspective, because he was an outsider coming in versus myself. I was already immersed in the community. I grew up there. So he had to establish those connections and build those relationships. And he eventually hired me, and we ended up partnering with these organizational partners. And the idea was that we would have 1 to 2 representatives from each of those community partners, and we would have these ongoing meetings and ongoing process, and we would expect that everybody would be involved, right? They ultimately identified the concerns. And I think at the time, Dr. Padilla was interested in doing cancer research. And what had happened was the partners, through his conversations and through building these partnerships, he realized that the concern for the community at the time wasn't necessarily cancer research, but rather experiences in the healthcare system. And so he shifted gears and completely changed the intent of the research. And the idea for us was that because the communities were so unfamiliar with CBPR and research as a whole, we really employed a flexible approach. And so we mutually agreed that the partners would be involved in all phases of the project as much as possible, but at a minimum, they would help us facilitate data collection, and they would attend meetings, and they would kind of contribute towards a particular dissemination project. So not just publications for the sake of publications, but that there would be a product that would be beneficial for communities at the end. So on the surface level, we conducted 13 focus groups at 7 mosques, 102 participants. You can see that we had all of these publications, some of which were more community reports versus academic publications. We had a few dissemination outputs. We had a luncheon, a community luncheon, press releases, a policy report, etc. Right? So we were successful in creating all of the outputs with the involvement of our community partners. And we cycled back the research to participants and stakeholders and shared the findings with them and, had a conversation about where to go from here. And I think the video was broadcast on YouTube, and, it was picked up by some media reports, etc. So on the surface, it, was great. But subhanAllah, within the actual experience, we were, even though we were successful in collecting and disseminating data about our research topic, we had a lot of challenges in maintaining the involvement of the community partners and sustaining the community partnership. So for example, at the mosque level of engagement, you know, many of you know, right? You're referred to various contacts within the mosque leadership. There's high turnover rate. So you might be working with one volunteer or one employee, and then that employee is no longer there, right? There was also oftentimes a unfamiliarity with research and mistrust of research, and like not really understanding why we were doing the work that we were doing and why it was beneficial for communities. On the partnership end, the community partners, if you remember, the 4 community partners, there was at some point the leadership changed and the two organizations merged. And at times there were different expectations about what the outcomes would be, right? In terms of dissemination. People were really limited in their time and oftentimes had scheduling conflicts because they were wearing multiple hats. They didn't really understand CBPR or the importance of research. And they were just young, under-resourced organizations and didn't have the infrastructure to sustain a collaborative research effort. So ultimately, we found that a CBPR approach with mosque communities was incredibly promising, even though there was some significant challenges in engaging the mosques, maintaining the involvement of the community partners, and actually sustaining the project partnership. The project partnership did not last after the project ended. And that was unfortunate, but it also speaks to the reality of our communities, right? And I think I just note this slide here because I want you to think about whether or not anything from our experience resonates for you in your own research or in some of the work that you've done. And it begs the question, is full CBPR possible for some communities? Is it possible to implement all of these principles that I outlined earlier with some of the Muslim communities, right? And when we think of our work, are we really aiming for community engaged, community-based participatory research? And is community engaged research enough? So just some questions to think about for your own experiences. You can read the full paper online. It's titled Using CBPR for Health Research in American Muslim Mosque Communities. Again, I should have put it up here, but it's titled Using CBPR for Health Research in American Muslim Mosque Communities. And we just outline our experience and we provide some tips for those of you, really anybody who is engaging mosque communities for research. What are some strategies that you might find helpful in conducting research with mosque communities? Finally, I'll leave you with this last slide to think about. When you see anything in the literature, any presentation that's describing a CBPR approach, it's worth thinking about some of these questions. And I think even thinking of them for ourselves as researchers. Who chose the problem to be studied? Who designed the intervention or the policy change or the research design, right? Who made those decisions? Who is writing papers or making presentations? Who's disseminating the knowledge? Where are they disseminated? And is there an intervention or policy change component to the research? And, this can give you a sense of whether or not this is truly CBPR or it's an attempt at CBPR or it's an attempt at community engaged research. And it forces us to reflect as researchers about our own work and where we kind of see ourselves situated in the larger field of community engaged research. So I'm going to stop here. Thank you so much for listening. And we'll take questions, I think, after Madiha presents, and I think we'll have a discussion. Thank you. I'll stop sharing my screen.
Thank you. Okay, our next speaker is going to be Madiha Tahseen. She's a research manager at the Family Institute, the Family and Youth Institute.
Okay.
Yes.
Okay. All right. Assalamu alaikum, everyone. Thank you for joining us this morning, inshallah. I'm going to continue the talk focusing more on some examples of how our organization does this kind of work. If you look at the title, I very intentionally said community engaged research, because as Amal already alluded to, it's very, very difficult to do full CPBR, although that is our goal. We aren't fully there yet. And so inshallah, I want to just talk about sort of what FYI does and then give you some examples where we've kind of worked at all ends of the spectrum of CPBR and some lessons learned, inshallah. So just a little bit background on myself. I'm a developmental researcher. My background is a PhD in applied developmental psychology. I came to the FYI because I was really interested in really serving the community, and I didn't want to wait for research to take its time to get to the community. And obviously being really interested in youth and families within the Muslim context specifically. So that's kind of how I got to the FYI. Before going into the really specific examples, I just want to tell you a little bit about what we do, so then you can kind of understand, working backwards, how did we apply the CPBR model to some extent. So the FYI is that, if you haven't heard about it, it's a nonprofit, independent research and education institution. Our goal is really to encourage the thriving of young people and their families. We focus on research and community education on 4 focus areas: positive youth development, healthy marriages, effective parenting, mental health, and well-being. We do this in many ways, and our goal is really to reduce stigma when it comes to a lot of understudied topics and really increase mental health awareness. So we adopt a really developmental approach from infancy to elderly in terms of the areas of focus and resources that we disseminate. We have a developmental approach, so we're really interested in creating enabling environments that touch youth in many ways. So looking at the home, looking at schools, and looking at mosques. And our goal is, through this work, so I'm operating 2 computers here, it's a little challenging. Our goal is to really provide resources that strengthen individuals, families, and communities, but also ignite community-wide change. That community piece for us is really important. And that's really what I'll spend time today talking about, inshallah. So like I said, let me show you the resources that we create first, and then I'll work backwards to show you how we've inserted the CPBR approach in each of those resources and some unique examples. So we have infographics that we create, which are really, again, just kind of that first touch of the community with research. It's really just to raise awareness of the issue. They're created based on data-backed, research, just a quick snapshot of the challenge, just to get people kind of thinking and provide some very brief solutions. Then the next kind of level is videos. So these are very short, quick action videos that provide some solutions and some action steps that people can take instead of just listing problems, which is what infographics really do. So just do a little bit more of inspiring change in the community, get people thinking about issues that are, stigmatized and taboo. And then we follow this up with a lot of continuing education through workshops, webinars, and toolkits. So the workshops and webinars, as you guys see, they're research and clinical based. We make them culturally and religiously tailored to the specific community that's even requesting them from us. What are the unique challenges they're facing? And that's also kind of our way of really being in touch with the community and on the ground. And they're very interactive and skill building. So the goal of these workshops is, again, we've raised that awareness, hopefully through the infographics, the videos. Now we follow that up with some skill building and, further knowledge for people to walk away with. And then the last step is really additional resources that they can really build on their own unique problems and work on one-on-one through professional resources, daily articles that we share, the research resources, and then our most popular are the toolkits. So these are really extensive toolkits where lots of different audiences, can go in, whether you're a researcher, whether you're a mental health professional, whether you're a parent, a youth yourself, and just look at the different issues that are there and, get resources that are available to you. So like I said, the goal of this talk is how do we do CPVR on the ground? So how do these resources come into play with that approach? And that's really what I wanted to walk you guys through and give you that example. So the way we've applied it is we work through this theory of change or logic model. To really work towards a CPVR model, we really believe that the first step has to start with identifying the issues, right? Working with the community to understand what are the issues that the community is facing, what is the community feedback that's necessary, what are, through needs assessment, listening sessions. I'll give lots of examples when I actually go through a concrete project, but that first step to us is really key. And we have established that as part of all of the work that we do with the community. Then we follow that up with step 2 and a little bit of step 3 with it, which is the research. So really conducting behavioral research, identifying all the unique nuances that exist in existing research, as well as conducting that research to understand what does the problem look like from the academic perspective. And then in step 3, and this kind of happens through step 1 and step 2, is really solution seeking, right? We don't just want to walk away with a publication. We don't want to just walk away with a research study. Is in those community sessions, in that community feedback, what kind of resource makes the most sense for this community and for this topic, right? Some topics, a workshop is not going to make sense, right? People aren't going to show up, for example, for a topic on substance abuse, right? To their community in front of everybody, right? So again, understanding what is the solution that's needed for this community and this topic specifically. So that's a big part of what we do throughout step 1 and 3. And then we take that information and disseminate it, right? Giving back to the community through resource development in a way that makes sense. Not everybody is going to understand and read research papers. So we have to disseminate that. And again, a means that makes sense to the audience, and with all levels of access, and then acknowledging the intersectionality that exists in that specific audience as well, in terms of what's created. So again, this is very high level. I'll give you examples in a minute. I just wanted to kind of give you guys the approach that we take. And then step 5 is really implementing that research through dissemination, but also evaluating the effectiveness of that dissemination. Step 6 is really, again, the impact of analysis, both of our workshops, but also of, dissemination of infographics or toolkits. That's an area we would really love to grow and are trying to grow as part of our strategic plan. It's really difficult to think about, how do you evaluate the effectiveness of an infographic, right? And inspiring community change. So I'd love to have conversations around that, inshallah, if we have time. Okay, so that's kind of overall what we do. As I mentioned, the first step for us is really key is in involving the community is identifying the issue. And so FYI, through its experience in the community, through its leadership, has really been able to build community trust through community feedback. So we have, whether it's within FYI leadership itself, whether it's in the broader FYI team, we have leaders who have contact with key community partners, key stakeholders in the community, whether religious leaders, academic leaders, scholars, activists. So we have connections with them across the board. We have connections with individuals through our community workshops and through all our different social media platforms. And then through active community feedback with needs assessments and listening sessions for each of our projects, we're really able to engage the community in whatever project that we're going to work on. And this is why I was saying it's not community based in that sense, but it is community engaged. And because we've been able to do that, we really have earned the trust of the community. We're community connected, we're on the ground. When we go out to workshops, we hear what people are struggling with, and that drives the next issue we're going to take on in the next 5 years as an organization. So they are the ones, the community is the one that sets the tone for us in terms of what is the next project we want to take on and what are the unique nuances we need to make sure we take into account. So we get the language of the community that way. We're aware of sort of the, socio-political nuances, the uniqueness within different communities. It's not we are a Muslim community, but we're also Muslim communities, right? So being aware of that, by being in touch with the community on the ground through the workshops, through our listening sessions, we really have been able to do that and hope to continue to do that. So, sorry, let me go into some specific examples to show you how we've done this, and then I'll go through some lessons that we've learned and challenges we faced in each. Okay, so the first one that I think is probably our most systematic, and the one that I think we were able to get pretty far on the CPBR spectrum, was our pre-marriage work. So this is started, I'll show you how we kind of started from the community throughout research and getting back to the community with dissemination. So our pre-marriage work started with research that was conducted by Amal, who you guys just heard, who's an FYI researcher. In collaboration with the study she did with ISPU, she conducted research on marriage education and the counseling needs of Muslim Americans, Muslim American couples, individuals, and in the community. So she did extensive literature review. She did consultation with experts, both academics and scholars, as well as community leaders and imams, conducting in-depth interviews with them. So the first step of this project was her listening to the community through this project and publishing this report that you guys see. And so she was really able, prior to this, we had heard in our circles or through our connections with the community issues that, couples were struggling with. But she really brought in the research component and opened that door for the community to provide their feedback and say, this is what we're facing, this is the issue, and then these are the solutions we think would be helpful. So after conducting that research, we then took their opinion into consideration in terms of raising the awareness at a national level by disseminating some resources. So we created an infographic, again, just really highlighting very generally what the issue is that we found in listening to the community, as well as other existing research. We created a short video to just highlight some action items. Again, created a workshop about this, one of many workshops. One of the things that we learned from the workshops, and this is where I was saying having a continual feedback loop with the community is so important, because it helps you stay on top of what the community is feeling. And then it really feels like, makes the community feel that their voice is centered in what you're doing. So through the workshops, we were able to learn, okay, not only are people struggling at this stage of like, I'm thinking about marriage, I don't know what to do, which is where a lot of this research was centered on, but people are also looking for resources through the courtship process. So now I'm talking to somebody, now I'm engaged, I need help. And we all know research shows that premarital education really prevents a lot of marital conflict and even divorce, right? So through working with the community in these workshops, that's what we learned. And so we knew that was kind of the next direction we wanted to go. And so we created, the marriage prep toolkit, which is really to guide people through that courtship process. But it's also still tailored for people in that beginning stages of, okay, I think I'm ready to get married. What is the self-work that I need to do before I talk to somebody, or before I need to, think about looking, or if I am actually looking to get married. So that toolkit, again, was created with community feedback in partnership with the community, and when I say with community feedback, I'm talking about like we had experts in the field review the work toolkit. We had community members review the toolkit, provide their feedback, give us, that all of that insight that's needed. So it really speaks to their unique needs, but also their unique solutions that they think are the most helpful. And then the last step, not last step in this project, inshallah, we'll keep going, but the last thing that we have most currently is the online course. So one of the things, like I said, we learned in our community feedback through the workshops, and as well as the toolkit, was, hey, we actually need a lot more hands-on, faith-based, clinically relevant content for couples who are actually engaged. So that next step of the marriage process, right? They're engaged, they look up marriage, preparation, marriage counseling, either it's really expensive or it's unavailable, or it's, not faith-based and clinically valid for their unique experience. So that's kind of where we took the next step of this project. Was we just recently launched this online course called Prepare to Pair. And it's really aimed at couples that are engaged and in that courtship process. But again, we could have said, hey, we're just going to take, you know, this before you're ready to even get married and take that into an online course. But that's not what we were getting from the community. What we were getting was they were looking for this need. This is the need that was present for them. And this is the niche that we needed to fill. So that's kind of the full spectrum of what we did for that project. The next quick example I wanted to give you is our work on the Black Muslim youth and their families. So this is an example that I think where the research itself was very much community engaged. And the dissemination pieces, we haven't done as much with it because we need more community engagement there. And we recognize that's where we need to work. So this project came about in 2009. You know, we received a lot of questions and concerns about the unique experiences of Black Muslim families and Black Muslim youth. You know, the intersectionality of racism, both within the Muslim community, outside of the Muslim community, a lot of the unique struggles, but also a lot of the unique strengths that exist in this community and how that's not recognized. So working with those partnerships and those organizations, we, you know, began this research process. We engaged those same individuals who reached out to us and said, this, you know, this is a struggle, can you support, to actually come up with the research questions for this study. So again, they were fully involved in the creation of the research questions and the methodology, in the work that was done in terms of the in-depth interviews and focus groups and the surveys that were conducted, so that we could really get the voice and the experiences of Black Muslim youth, of, you know, leaders, parents, and mentors who we all engaged throughout this project. So this specific research study, again, was in our opinion, was very much community engaged. And we took that research and then disseminated it both into the book that you see, which is Uplifting Black Muslim Youth. And then we also got feedback to turn it into a toolkit, because again, people really wanted to be able to act on the recommendations that we, you know, were uncovered in the research. I didn't get to put it on here, but we also have a Black Muslim workshop, which is both aimed specifically to Black Muslim communities, but also to communities that are immigrant oriented or immigrant centered, and how they need to look at and uncover issues that they are experiencing in their community in terms of supporting the Black Muslims in their community. So this project really helped us to learn about what community partnership looks like and what collaboration looks like. And I'll go through some of the lessons learned as well a little bit further. We haven't moved forward in dissemination for this yet, because again, we want to take it back to the community. So one of the things we learned through the workshops, and one of the things we're actively working on now, is we are partnering with those same organizations and those same community leaders we started the research with, to now revisit this resource specifically and say, hey, tell us, does this make sense for your needs? Does this make sense for your community? Is it highlighting what you thought it should be highlighting based on the research that you helped us with? And what are next steps? So we're actively working on that, and also building some more longitudinal research with those same partners to really get at the heart of their experiences. And the last example that I just wanted to give, and then I'll end inshallah after this, was some of our risk behavior work. So this kind of project in my mind, I joined the FYI in 2012. So this is a little bit before my time, not 2012, sorry, 2015, right when I was about to graduate. So this is before my time. But this project in my mind is kind of the opposite of the Black Muslim youth study that I was just talking about, where this is very strong on the dissemination side, but not so strong on the research side of things. So essentially the history to this project was that we had youth workers and, you know, imams contact us and say, you know, we're really struggling with this in our community, but nobody wants to talk about it. You know, we have youth coming to us who are smoking or drinking or talking to us about, you know, premarital sex. We have so many stories I could share with you all of what we received, but there was nobody wants to talk about it. So there's no resources that people can, you know, talk about. And again, this is a little outdated. So we're talking about before. Now, alhamdulillah, we have a lot more resources. So in the interest of the need that we were facing, instead of conducting research, we analyzed some existing data and created, you know, this digestible, relevant, you know, infographics So the dissemination was good. We created videos. It was received by the community in mixed ways. And I think part of that issue was because of the research side of things. So the research was not, it was not our research, right? So it's secondary research we analyzed. The research is not community-based. It was not diverse. It's not representative. It did not understand or incorporate the community-based voice in any way, right? But again, there was a need. So in that moment, the need needed to be filled. And, you know, that's kind of the approach we took, but, you know, we have lessons that we learned from it. So it's just an example. Through these 3 different projects, I just wanted to show different ways that you can engage with the community and kind of what are the benefits and drawbacks of each. So I'll just end with, inshallah, the lessons that we've learned, and then, you know, open it up for question and answer. So some of these challenges Amal definitely highlighted in, you know, her presentation as well as her publication. I wanted to kind of apply those specifically to our examples that we went through. So some of the research lessons that we learned, again, as Amal mentioned, capacity is a huge one, right? Understanding the research process, having the right team to be who are skilled in research. So to do it with integrity, with validity, right? That takes time and it takes capacity to build. You know, your ability to also, as a nonprofit organization, funding is a big deal, right? Being able to apply for funding to academic, you know, oriented funding sources really limits your opportunities. So that's just a very practical, you know, barrier that did exist for some of these projects. So alhamdulillah, since then, we have learned a lot more of other funding opportunities and other sources that, you know, we can look into, but that was definitely a lesson that we had to learn. Knowing what you don't know, right? So I want to speak about this more at an organizational level, right? One of the lessons we learned in some of these projects is, when do you as an organization recognize that this specific topic or this specific community is not your wheelhouse or is not your expertise? It might fall under, for example, one of our 4 focus areas, but it might not be something that you are placed in the right position with the right team to address. So recognizing that and recognizing when is the time, you know, but you might have the resources that exist. You might have the community relationships and you might have the community trust to push that work forward. So recognizing that what that means is, if you aren't the right person to do it, elevate the organization that is the right person to do it. So we learned to partner with, you know, organizations who are the right organizations to do it and uplift their work and help them and mentor them to build their capacity. So that was a lesson, you know, that was important for us to learn. And I think in general, when you do CPBR, realizing that that might be some, you know, something that you kind of come across and what, you know, where are you going to go in that fork in the road? And then growth mindset, it's more just individually, I think, as on an individual personal level, recognizing when an area of expertise requires more work on your part. And when you need to do your own, you know, unlearning and recognizing your own biases or your own, you know, just realization that, hey, I don't really know much about this area. And so I need to spend more time either learning about it or learning from someone else who knows about it, and then deciding where do I want to go on that specific topic. And then lastly, just community lessons. Some of these Amal already mentioned, so I won't go into them really specifically, but so need for research and understanding the research process and the time it takes, but also why it's still important to do solid research. Like I mentioned with the risk behavior study, the community, you know, is going to be all up in arms if it's when they realize the findings might not come from such great research, right? And so that's actually when they realize how important solid research is. So that actually did benefit us in that way, right? Is it actually helped them see, okay, research is needed and doing it the right way is needed, and we need to be patient with that. When I say balance, I'm talking about the balance between when is it a time, on the spectrum of community-based research that you guys saw, when is it the time to, based on the issue and the community you're talking about, do you have the time to do the full process? Or is the need so great that you just need to get the research out there? And if it's solid, valid research, right? So knowing that balance, navigating that balance was something that we, you know, learned as well. And then the last 3 just have to do with directly with the community in terms of recognizing that resources and dissemination needs to be available, you know, that language is an issue. So our resources, of course, are all in English, right? So that's a barrier for a lot of people. We try to make our resources very, very accessible in terms of the platforms, but it is a lot of digital content. So what does that mean, right? And then of course, what topics you take on when it comes to stigma and taboo in the community. And so navigating that, handling it the right way, but also not shying away from things that need to be talked about because people need help. So one of the big projects we just took on now is pornography. So navigating all the stigma that surrounds around, you know, people saying, well, this doesn't exist in our community. Well, the data shows a little bit different, right? So navigating all of that was definitely lessons that I think I've learned personally as a researcher and, you know, worker in the community, but also I think as an organization. So those are just some of the different lessons that we've learned throughout this project. So I'll end there, inshallah. As I said, our goal was really to show you all how FYI is engaged in community engaged research through different projects across the spectrum in different ways, and how we're hoping to continue that work, inshallah. Jazakallah khair.
Questions, discussion?
I'm actually interested in your experience with the working with the imams at the mosques. Part of my study, I'm interviewing religious leaders, so mosques, but I wonder if they truly represent the community, because I'm also interviewing participants from the community itself, and they feel that the imams are not doing enough with regards to mental health. So that's my interest, is mental health. So they feel that the imams are not using the platforms that they have available to them to address mental health issues, and only when something happens do they talk about it. But even then, it's not really spoken about in a way that is, you know, that would be beneficial in understanding from some perspective. So I wonder what was your experience like with the imams and with the community members, and whether they saw that the imams of the mosque as, you know, people who actually represented them, and if there was any challenges with that.
Yeah, that's a great question. If you guys didn't hear it on the Zoom, the question was about working with imams and community members and the challenges we might experience with imams, right? Yeah, so that's definitely been one of our bigger areas of challenges, I will say. Of course, there have been imams and religious leaders who have been great too, who have been advocates and have been partners in all senses of the term. But the ones where we've struggled, absolutely, we've had challenges where either, you know, when you say mental health, the first person anyone actually thinks of who's not in the field is mental illness, right? They freak out and they think like, oh, you're talking about, you know, we're not talking about crazy people. No, that's not all that mental health entails. So I think a big part of it is just there is an awareness. And I think if you can, before you even get to the call to action, right? What is it that you're asking them to do? You have to first work on clearing up their misconceptions, building their awareness. And I think when you get them to be on the same page with you on that, then you can get them to the point where, okay, now this means you need to use your platform to, you know, encourage mental health education in the community. You can't do any of that until you erase some of the misconceptions that exist. One of the biggest ones is that psychology is over here and Islam is over here, right? So I can't tell you how many, I've had sessions where it was like a regional meeting of the imams. They like meet quarterly. And I only had a few minutes. It was hard to pick, like, what do I focus on in a few minutes? But like everybody's first off the bat was like, oh, do you have imams in your organization? They were looking to see if our organization specifically was just like a psychology organization, or was it also like, and Khalid knows this very well, or was it like, you know, how do we incorporate the two? So I think first really helping them understand that they're not separate, they're together, right? And there's a lot of work that FYI has on that can help you erase some of those stigma. And Khalid actually is one of the researchers that can talk to you about that. So I think I would start with that. And that really helps. I think when you can explain to them that psychology is not here and, you know, Islam's not over here, that they actually go hand in hand because they are really one and the same. I think that really helps. I think really giving them, you know, the typical like interpersonal skills that are needed when you talk to anybody, right? Where you don't talk down to someone, you don't use your background to like, you know, be kind of like those same kinds of interpersonal skills. I think imams are just as important. So making sure you meet them at their level, making sure you're giving them a chance to really address their questions, all those kinds of skills, I think, are just as important in erasing the misconceptions that they have. The other thing that was really helpful is sometimes people are hesitant because they're just overwhelmed, and they need just some guidance and support. A little bit will help them out. So I think one of the things we did, for example, when a few communities had experienced suicide was, and we had gotten requests for, you know, help in navigating the issue at the ground level with that specific community, we actually worked on like a suicide khutbah. So, and this actually was also the same for some pre-marriage work that happened as well, is I want to talk about this, I just don't know how. I don't know if I'm gonna say the wrong thing. So having a little bit of support and guidance helps them out as well, because it erases some of like the anxiety they might be feeling around addressing and what the community's response might be. And I think the last thing would be just, again, making sure that they're aware of resources that do exist. Oftentimes people just don't know. They're overwhelmed, they're busy, they just don't know. So making them aware of, hey, you can turn to this or you can use this. You know, you don't have to be the expert, just leverage the expertise that does exist. I hope that's helpful. I know that's
Madiha, if I can add,
yeah.
I was just going to add from our experience with the health study, we had actually really good feedback from the imams, and I think because also the framing of the study for us, I mean, many of you know this, right? Mental health is one topic, but health in general, sometimes people are more receptive to it because it's not as taboo. So our study was kind of a larger health study, but then when we framed it as a study with the intent to help people access services in a more culturally sensitive way and improve the health of the community, the imams in particular were really incredibly receptive. And we actually did kind of like a tour around Southeast Michigan. We literally, the research members all jumped into the same car and we drove from mosque to mosque and had meetings scheduled with the imams and met with them, presented the study to them, and then very simply explained what we needed from them. And primarily that included their support, right? That they feel like they're invested in the relationship and they're invested in the study, and also that we couldn't do this without them, right? Like we needed the imams to help us recruit. We needed the imams to help promote the study. We needed to even interview this. So we interviewed some of the imams, right, for our study. But I think the framing was really helpful, and actually engaging, like face-to-face engagement, like a really simple meeting, and you know, without the formality sometimes that happens in academic institutions. I think we found that quite the opposite. They were very receptive. And in fact, for our recruitment, I would say that we had the highest recruitment numbers based on imams making announcements during Friday prayer about the study and encouraging people to participate because they had credibility. And so if the imam is saying this is a legitimate study to participate in, then we should participate in it. So we had actually a very positive experience overall with the imams for our particular study.
And the last thing is, if you are struggling a little bit, also sometimes thinking if you're the right person to talk to the imams. So unfortunately, there are, you know, biases when it comes to, you know, I'm just going to be real, a woman being the person, right? So gender, right, all of that. So, and then again, beyond gender too, just if you're not an insider in the community too, right? So you have to know who's the right person to talk to. That person is the one that talks to the imam. So, you know, maybe trying some of those strategies could help too.
I was going to ask something similar about how do you get the community members receptive? I mean, you talked about the imams and some of the skills will be common, but if you had any more tips, that would be nice. Because I work with college students, and it's pretty easy to talk about a lot of different things, but I find it more difficult to bring these topics up with like elder community members.
Yeah. Yeah, I think it really varies because especially like if it depends on where the imams are at in terms of their take on mental health, like what I was saying before, like mental health, Islam, psychology, all of that. If they're really at the, you know, the one end of the spectrum of, oh, this is like that Western American thing, you know, we just use our deen and that's it, right? Like if they don't see any integration of the two, to me, in my experience, that's been the toughest crowd to talk to. Is that who you generally struggle with, or
like the people? I mean, like the general audience. Like, do you feel like the audience of those imams, like, kind of?
Oh, I see what you're saying.
Yeah, just
they're more receptive.
But like, do you think it's more difficult to talk to audiences of those types of communities, or?
I wouldn't say consistently.
Okay.
No. Yeah, we've been in communities where the community is totally on board.
Yeah,
and the leadership isn't.
Yeah.
We've been in communities where they're, you know, synced, and then we've been in communities where the community is also really difficult to like talk to. But the leadership is actually really like, and usually it's because the leadership is younger or just happen to you know, have had experiences or learning in this realm. So they want to move their community forward. So it's been a mix of it all.
Some questions. Thank you for your presentation. I know I came in late, but two of the things that came up for me, one thing you had talked about being a nonprofit and not finding the funding or not getting the funding, right? So just the Center on Muslim Philanthropy came in mind. So I'm not sure if you know about them or you're in partnership with them. Yeah. Okay. Yeah. So that's done.
Yeah.
And then the second thing was like the pre-marriage toolkit, right? So I'm just curious as the connection or the collaboration between, you know, FYI and, you know, like couples therapists or people who are doing the premarital counseling. I know we have our group, and a lot of times we'll ask for toolkits or we'll ask for resources and it'll be sent on there. But is there a more like streamlined like connection? Is there like a specific email list? This way, because I didn't know about some of these toolkits, you know, so I was wondering about that connection. Is there something like maybe workshops for some therapists, you know, who work with couples, or just like informing them, letting them know like this is a new toolkit. You can give this to your couples. You can, you know, guide them to our website. Like, what is that connection?
So kind of like the dissemination strategy. It sounds like what you're asking about. Yeah. So there isn't there's no formal listserv that I know of like Muslim therapists. If there is, definitely share it, and I'll share it with like our marketing team. But see, there's an idea.
There we go.
I know. So before talking about dissemination, in terms of creation of the resources, in that process, we do engage whatever professionals needed for that topic, right? So for the pre-marriage toolkit, you know, we engaged licensed LMFTs, right? There, you guys. We engaged a few you guys to review the toolkit extensively, provide feedback, you know, make sure we're not missing anything, make sure it's capturing all the unique aspects needed for each stage, because that toolkit is set up in stages. So we did that in terms of just the creation of the resource. And we do that for each of our resources, whatever the topic is. In terms of dissemination, we try to disseminate so we disseminate to any of the communities we visited. We have our social media strategy. We also disseminate to people who we think are community gatekeepers, who one, helped us with the project to start with, right? For sure, we disseminate to them. But also if they, you know, connect us to any organizations or, you know, like listservs, things like that. And then everybody that's on our email listserv. So if there are therapists on there, they'll receive that. We're trying to get more structured about, so for example, if something comes out about bullying, right? Just as an example, we make sure that all the bullying organizations out there, whether they're Muslim or not Muslim, receive it. When the Prepare to Pair course was launched, we made sure that it went to all the different marriage service platforms that are out there, right? Muslim specific ones, as well as, you know, anywhere where the clinicians might be who would benefit from sending this to their clients. Whether that piece needs to be more structured, 100% agree. But again, that's also a capacity issue, right? It's having the capacity to do it. But if there are suggestions, we would love to, anyone, if there are listservs, if there are groups that you guys think it would be beneficial to send this stuff to, definitely let us know. We will add them.
Madiha, we also disseminated on the Muslim mental health WhatsApp groups.
Yeah, Sadia mentioned that. But as you know, it's a WhatsApp group, right? So there's so many messages.
Everything is lost in there.
Yeah. So
with some ideas.
Maybe, but maybe it means we, like, if there's a separate, you know how that same group split into some of the subfields? Maybe if we're able to separate, disseminate in those subgroups might help, really focus people's attention. So.
Or even non-Muslim specific listservs. I don't know if there are any, but for providers who are maybe in licensed marriage and family therapists in particular, because they tend to be the ones doing the marriage prep more often, or even marriage prep facilitators, because I think that's also another potential route, I think, because there are some who are trained facilitators, but not necessarily fit into LMFTs. So please give us feedback and any suggestions. We're open.
Right, because for us it's like, of course there's all this stuff out there. How do you not know? But that's us, because we work on it so closely.
Yeah, and also the feedback has always been, particularly from couples. I just gave the marriage prep workshop in Michigan a couple of weeks ago, and people are floored by the amount of content in the marriage prep toolkit in particular, because there really is no other resource. Like, you have to kind of scramble a little bit from a book here, a little bit from a resource online here. And we've done the work. I mean, it took us almost 2 years to produce that toolkit. So it's very thorough. So people are so excited to have it once they know about it, but it's really difficult getting the word out. And I think sometimes it also is because people are not really as concerned until they're going through the experience. So thinking about timing as well, and maybe connecting with the religious leaders who are oftentimes doing some of the marriage prep, however they define it, and just really offering it as a resource, because they don't want to be doing all the work either, right? So yeah, I think we just have to brainstorm a little bit more about where or how else to disseminate.
But one quick idea is like having a relationship with like an influencer who has like a lot of followers and who is a therapist, right?
Yeah.
You create that relationship with them. They do like a free webinar. Everybody registers, and now they have all the information, right? To like all of their thousands, maybe 100,000 or 1 million followers.
Yeah.
And now just letting them know about this.
That's a good idea.
Yeah. That is a really good idea. I think I was just going to note one thing here is sometimes as an organization, I think this is part of the challenge too, right? There are, and many of you probably in the room or on Zoom know this, right? There are kind of fads. And so we're just really careful that we don't fall into kind of the gimmicky stuff that we see online, because we really value people's trust and want them to see us as credible, because we have experts and this work takes so much time. So part of the challenge is how to kind of maintain that balance, right? When you're working, so much of community now is online, and that, I mean, so much of what I presented looks so differently online. Right. So just trying to maintain a balance between connecting with people digitally and in person, but also doing it in a way that's still trustworthy and maintaining that relationship over a long period of time, as opposed to we just want your numbers. We just want you to register so we can, et cetera. Yeah. So that's part of the challenge as well.
Yeah. I'll be in touch.
Sounds good. That's what we love.
I just wanted to thank all the speakers. Unfortunately, we have an award ceremony at 11 in the main hall. So I just wanted to give everyone some time to make their way over. But I just wanted to thank Madiha and Amal again. It was very thorough and very informative.
Is that fair?
Thank you.